Friends, this is an unedited video recording of Phaco emulsification of a soft cataract. Let us observe the surgical steps. The main incision has been placed, viscoelastic substance has been injected into the antechamber. It is sprayed over the corneal epithelium for protection of corneal epithelium and better visibility. Now, 2 side ports are made about 3 clock hours away from the main incision. After making these side ports, capsulorhexis is done. I usually incise the capsule, raise a capsular tag, hold this tag with a Utrata forceps, and with anti-clockwise movements I do a rhexis. It is very much possible to do a nice rhexis with a needle only, with a 26 gauge bent needle, but in intumescent cataracts it is better to use a forceps which gives better control over the anterior capsule. Hydrodissection is done and the nucleus is tapped and the nucleus is rotated, which indicates that the nucleus is free from the capsule. Visco is again injected and now the tip of the Phaco handpiece is introduced into the anterior chamber. I am using Phaco 2 mode of Oatley Cataracts 3 Phaco machine. Phaco 2 mode, in this case the Phaco power is 40%, flow rate is 40 ml per minute and vacuum is 400 mm of mercury. What I do in soft cataract is make a small pit and there I just support the nucleus without using any vacuum and then slice the nucleus with the chopper. If I use vacuum while the chopper works, what will happen is the pit that I have made will just enlarge and it will be difficult to slice the nucleus. In soft cataracts there are many ways. I sometimes use the lens tilt technique, sometimes this mechanical chop where the nucleus is just supported by the tip of the Phaco handpiece and the chopper slices the nucleus. And sometimes if the cataract is very soft, it comes just by aspiration, which is called Phaco aspiration. Now after taking the nucleus out, the antechamber is again filled up with viscoelastic substance which keeps the antechamber formed if you are working with Simcoe. There is irrigation with Simcoe, but if the antechamber is having some amount of viscoelastic substance, the chamber stability is much better when you are working with Simcoe cannula. And now this is called hydro polish. The irrigating jet of fluid is swept over the posterior capsule. The cells that sticks to the posterior capsule gets dislodged and it gives a very clean posterior capsule. This is called hydro polish. Irrigating jet of BSS being used to polish the posterior capsule. Now this is a hydrophilic acrylic intraocular lens being implanted under irrigating fluid. Irrigation keeping the antechamber formed and the lens is implanted in the bag. And this rhexis is ideal because you can see that the rhexis margin is covering the peripheral portion of the optic of the intraocular lens. So the rhexis size is between 5.5 millimeter and 5 millimeter, so that it covers the optic of the intraocular lens nicely. And this is good because the lens cannot tilt. There is nice centration of the intraocular lens if a small portion of the optic of the intraocular lens is covered by the rhexis margin all around. Thank you very much for watching. Hope this video will help you in developing your surgical skills.